Hi, so continuing with our series of medical facts, I'm up with the second video in this series. So let us quickly revise few flashcards which are important. The first thing is weak OK sign. Weak OK sign is seen in what? So basically weak OK sign is inability to approximate the thumb and the index finger like this. So the patient won't be able to do this. It is seen in median nerve injury cases. And median nerve injury is seen in what? This is also important. Supracondylar fracture, anteromedial displacement. Yeah. The next flashcard is what is the mechanism of ulnar nerve injury in case of supracondylar fractures? Basically, ulnar nerve is not commonly injured during the supracondylar fractures, but if it is injured, so what is the basic cause of mechanism? Elbow is in flexion and the fall is on the outstretched hand, and the anterior displacement of the distal humerus fragment can impinge the ulnar nerve. Basically, the two things which are injured in case of supracondylar fractures you need to remember is radial nerve, brachial artery, median nerve. These are the things which are injured. Ulnar nerve injury is very rare, but when it does in these two conditions. Next flashcard is the location of ulnar nerve with respect to the lower end of the humerus. What is the location? So ulnar nerve is located posterior to the medial epicondyle of the humerus. It is located posteriorly. So I was telling you, which structures are damaged during the supracondylar fractures. So there are two types of supracondylar fractures. First is anterolateral supracondylar fracture, second is anteromedial supracondylar fracture. In case of anterolateral supracondylar fracture, radial nerve is injured, whereas in case of anteromedial supracondylar fracture, the brachial artery and the median nerve are injured. As I already told you, weak OK sign. So let's come to the next flashcard. Age-related Sika syndrome and Jagran syndrome. You have to differentiate between these two. Age-related Sika syndrome is basically due to old age. In this, there is decreased exocrine output from the lacrimal and the salivary glands, and it is ANA negative. Whereas in case of the Jagran syndrome, it occurs at a younger age, and it is an autoimmune disorder. So lymphocytic infiltration would be seen, and it would obviously be ANA positive. Next flashcard, tendons involved in the decurvent tenosynovitis are abductor pollicis longus and extensor pollicis brevis. Stay tuned, I'll be up with a new video soon.